Hi, Lynn. How are you?
Good. Thanks so much for being a patient advocate for JKPPA. Are you a healthcare professional?
I am not, and I in any way, but I did advocate for my parents prior to having to advocate for myself for many, many years.
Thank you for sharing one of your recent experiences with a medical diagnosis that was hard for you to get.
Yes, that's accurate. I had spent several months, almost close to a year, searching for mysterious ailments that I was having, and finally got to a specialist who correctly diagnosed me, but then dismissed me as a patient because I expressed extreme frustration with the practice for not getting me answers on a timely basis, which is critical for my disease.
When you had come that far and finally obtained answers, but then got dismissed, did that impact your ability to go forward with your treatment?
Hugely, I was told that I was in need of a new type of medication. It's a very serious self-injectable medication. They said I needed it. They got it approved from my insurance. They prescribed it upon many phone calls from myself because originally they said I needed it but didn't prescribe it. And once they did that, they dismissed me as a patient. I found that to be unethical, if not irresponsible, and was left with a prescription for a self-administered injection with no one to follow me, to instruct me, to talk about my concern, should I have a reaction to that drug.
Did you have to be persistent to even get the medication?
Oh my God, yes. I was calling, I was going through the portal, and all of these were met with responses by the team from my doctor's office with great confusion every time I would ask a simple question. It was like Groundhog Day.
How do you think that an experience like yours could be avoided by other patients?
Well, firstly, I think it's incredibly invaluable that it be avoided because I think had I had an advocate at the time, even though I was able to speak for myself, I was not being heard. And perhaps an advocate would have enabled this process to be streamlined, and I could have gotten the care and the medication that I required on a much more timely basis rather than extending my uh, pain levels, subsequent medical issues, uh, and had it been addressed more quickly. And therefore, I think that it's critical that everybody have an organization such as JKPPA to speak for them. I know in my circumstance, stress is a huge trigger for my disease. And this experience alone caused me more stress than anything else along this journey.
You are, but it doesn't
Uh,
matter.
well, I had called the hospital's patient advocacy office. Of course, I haven't heard back from them, and it was weeks ago, and told my story. And, the problem is they work for the hospital. And so they're not going to find fault with their own employer. The other thing is, insanely, they contacted me, Lynn, yesterday with an appointment for a follow-up study that was completely irrelevant. And I said, how is it that you're calling me now? And she said, "Oh, well, yes, I see was ordered in June, but we're calling you now." It's insane. They didn't call me, they didn't take my calls, and now all of a sudden, my suspicion is that their advocacy office reached out to them and they were just backpedaling.
Well, I think that we've all learned some lessons from you, that we have to be advocates for ourselves. We have to follow up for ourselves. We have to question what's going on. And we have to calmly and with some appreciation for our healthcare providers get the system to work for us, because sometimes it's broken.
Exactly. Exactly.
Thank you.
Thank you.
Okay.